my name is Amber Goana and I would like to welcome you to my Med Talk. This is going to be some of the things I pulled from the CPJE California law exam, and as you can see, it's going to be basically like a little Naplex, and so each video is just going to go over each section that I kind of pulled little things from, and I hope you like it. For this section, we're going to be going over medications that have an FDA approval for the use in gastroesophageal reflux disease. First, we have antacids. Now, these work by neutralizing gastric acid. The onset of action is actually within minutes, but it only lasts for about an hour. All of these products are going to be available over the counter. So we have calcium carbonate, another name is Tums. You take 2 to 4 tablets as needed for symptoms with a max of 7,500 milligrams a day. It's safe and actually recommended in pregnancy, but it is known to cause constipation because of that calcium component in it. Then we have Maalox. It's made up of calcium carbonate and simethicone. It is also, again, known to cause constipation because it does have calcium in it. Then we have Mylanta Supreme. It consists of calcium carbonate and magnesium. There is magnesium hydroxide, which is also known as milk of magnesium. It's 2 to 4 teaspoons between meals and at bedtime. The max, though, is 12 teaspoons a day. It is known to cause diarrhea because it does have magnesium in it. Then we have Mylanta Max, which consists of magnesium hydroxide, aluminum, and simethicone. There's Alka-Seltzer, which consists of sodium bicarbonate, aspirin, and citric acid. You want to take 2 tablets every 4 hours with a max of 8 tablets a day. This does have a risk of bleeding because of the aspirin component in it. General precautions with all these antacids, the ones that specifically include magnesium or aluminum, you kind of want to caution use in renal dysfunction because that can accumulate in the patient. Some side effects in general is bloating, and remember the aluminum can cause constipation, calcium can cause constipation, and then magnesium is going to cause diarrhea. Next, we have histamine 2 receptor antagonists, H2RAs. They inhibit both basal and nocturnal gastric secretion. Their onset of action is less than 1 hour, and it lasts for about 4 to 10 hours. All of these options are going to have a tablet version as well as a suspension version. So famotidine, Pepcid, it's 10 to 20 milligrams up to twice a day with a max of 40 milligrams a day. It is known to cause QT prolongation, and it actually has an injectable formulation. So it has a tablet, suspension, as well as an injectable formulation. Then we have Pepcid Complete, which consists of famotidine, calcium carbonate, and magnesium hydroxide. We have Dexlis, which consists of famotidine and ibuprofen. There's ranitidine Zantac, which was actually recalled from the market, but believe it or not, they've actually put it back on the shelf under famotidine, which is totally inaccurate. But anyway, Zantac used to be ranitidine. It was 75 to 150 milligrams up to twice a day with a max of 300 milligrams a day. It is known to elevate your ALT levels, so just watching people who have liver dysfunction. It also had an injectable formulation. But again, yes, it was recalled from the market. It was due to unacceptable levels of carcinogen found in the tablets. We have cimetidine. It's 200 milligrams up to twice a day with a max of 400 milligrams every 6 hours. If you have a prescription for it, you can do 400 milligrams every 6 hours. It is known to cause gynecomastia, which is like, your man boobs. It also can cause impotence. Doses are okay until your creatinine clearance gets less than 30 milliliters per minute. Then you're going to have to start decreasing that dose. You also want to maybe even consider decreasing the dose if your patient's on 3A4, 2C19, or 1A2 inhibitors. And then the last option here is the nizanidine, which was the prescription-only version. It's 150 milligrams twice a day. General precautions, all of them should be taken 30 to 60 minutes before breakfast. You want to caution use in the elderly with renal function because it can cause delirium, confusion. And once your creatinine clearance gets less than 50, you might want to consider decreasing the dose. Unless you know you're on cimetidine, again, remember that one was less than 30. That's when you want to start decreasing that dose. Side effects, it can cause vitamin B12 to be lowered. Usually with chronic use, though, greater than 2 years is when you're going to see a decrease in your vitamin B12 levels, but also headaches. The last set of options we have here for the treatment of GERD is proton pump inhibitors, your PPIs. They irreversibly inhibit the hydrogen potassium APTase in the gastric parietal cells, which is going to stop the final step in acid production. And again, it's irreversible. The onset of action is 1 to 3 hours, and it lasts quite a while because of that irreversibility, over 24 hours. You have esomeprazole, Nexium's the brand name. It's 20 to 40 milligrams daily, and they need to be taken 1 hour before breakfast. There's also an injectable version of esomeprazole. Then we have Vimvo. It consists of esomeprazole and naproxen. There's omeprazole, which is Prilosec. It's 20 to 40 milligrams a day. Again, it needs to be taken 1 hour before breakfast. We have Zirgrid, which consists of omeprazole and sodium bicarbonate. Yosoprolol, which is omeprazole and aspirin. We have lansoprazole, which is Prevacid, the brand name. It's 15 to 30 milligrams a day. Again, needs to be taken 1 hour before breakfast. We have dexlansoprazole, which is Dexalent. It's 30 to 60 milligrams daily. Protonix, 40 milligrams daily. And it also has an injectable version, just like the esomeprazole. And then finally, we have Rebrazole. It's 20 milligrams daily. General precautions with all these proton pump inhibitors: the capsule formulations can be open and mixed, except for pantoprazole. You do not want to be opening and mixing or crushing the pantoprazole. It could potentially cause pneumonia in some patients. They all inhibit 2C19. Omeprazole and esomeprazole actually have an increased effect compared to the others, but they all technically do inhibit 2C19. Prolonged use of proton pump inhibitors can lead to C. diff infections. Because of that GI pH increase, it's going to promote the growth of that bacteria. It can also cause fractures and osteoporosis over time. General side effects: vitamin B12, hypomagnesia, headache, and also diarrhea. And those were all the medications they had listed for the treatment of GERD. Again, my name is Amber Gawana, and I wish you all the best in all your studies.